has partnered with faith communities and seminaries to bring together a conference related to inclusive ministries and congregational supports. The Collaborative on Faith and Disability is essentially a collaborative between a number of the university centers of excellence and with some others involved and some other projects like the Institute on Theology and Disability. And our mission has been to help people with disabilities and their families to have compelling opportunities and supports to develop and express their spirituality, engage in congregational life, and share their gifts and talents in ways that are personally valued and that strengthen community. We also see ourselves supporting people who are involved in that by providing national and international leadership in the areas of research, education, service, and dissemination related to disability, religion, and inclusive supports. The paradox about this webinar today is that yesterday I was helped participate in a Interfaith Conference in Dallas, Texas, and from another group that put together a really nice conference that drew a few over 100 people in Dallas. So our first presenter today is going to be Molly Cole, who is at the University Center of Excellence in Hartford and in Connecticut. And last fall, they had a interfaith conference, multi-faith conference, sponsored in collaboration with Hartford Seminary and other partners. One of the reasons we wanted to do this webinar was because other people from other university centers and perhaps from other bases in our communities have wondered about some of the dynamics and strategies for bringing together multi-faiths, from people from different faith backgrounds, to look together at the challenges and the promises of inclusive ministries and supportive congregations. So we're delighted to have Molly to start us off today. And Molly, welcome and thank you for being with us.
Thanks so much, Bill. This was a really exciting opportunity for us. We have been working on outreach to faith communities for a fair amount of time, but in this past year have had greater success than we've had at other times. And we really wanted the opportunity to share with you how that came about and where we see ourselves going with that. So if I can make this advance, there we go. So just in case you're not sure where Connecticut is, we're on the eastern coast of the United States. We're a little state. And the University of Connecticut is scattered, if you look at this slide, among these 4 blue blocks. The gold block in the middle is our main campus, and we're located all the way over here in Farmington, so we're about 40 minutes from the main campus, but we're kind of spread out. But you can get anywhere in Connecticut in about 2 hours, so being spread out isn't really much of an issue. At a glance, we are the 3rd smallest state by area. We have a pretty diverse population. Black or African American, 12%. Hispanic Latino is our fastest growing population, and that's at 16.5. However, if you go to the urban communities, it could well be closer to 55% in our 3 major cities in the state. So it's a fast growing, diverse population. This is old data. 2010 was the most recent we could get on this, but we wanted to share that we really do have a fairly diverse population by faith, including evangelical, Black, Protestant, Orthodox, and an array of others. And our biggest concern as a university was that in our past efforts to do outreach to faith communities, we found ourselves using our own contacts weren't representative of the vast array of faith communities in our state. And we were quite concerned with that and very frustrated with it because we knew that we weren't reaching other populations who could contribute quite a bit to this dialogue. So, knowing that, we reached out to the Hartford Seminary. Hartford Seminary is non-denominational. It's a graduate school. They offer religious and theological studies. They do a lot of continuing education with ministers in the area and with clerics in the area. And they have a whole array of multi-faith programs. And it includes things like the Hartford Institute for Religion Research, the Duncan Black McDonald Center for Islam, Christian, and Muslim Relations. They have a Black Ministries program. They have a Women's Leadership Institute. They have a Latino and Hispanic Ministries Institute. They run a number of certificate programs as well as graduate degrees in divinity, both masters, doctors of divinity, Islamic chaplaincy, religious studies, transformative leadership. If you go on their website, it's really quite impressive. They do draw an array of faiths to their work, Muslim, Christian, Jewish, Hindu, Buddhist, and other students from around the world. They are known as an international site, and they have been since they opened back in the early 1800s. So this is a seminary with a long history of diverse outreach. Oh, don't do that, just go forward. Okay, so our first effort at collaboration with them began, we have a colleague, Candace Lowe, who is the retired director of one of our state independent living centers. Candace is deaf. She also has a physical disability, and when she retired, she actually went back and took some courses at the seminary so that she could do more preaching within her faith community. So she's offered a number of well-attended lectures at the seminary campus on how to welcome persons with disabilities in faith communities, and I've attended a few of those. They're well attended not just by people with disabilities, but by representatives of this diverse array of faith communities. And so the last time I went to one of those, I started talking with Candace and the Hartford Seminary faculty about a way that we might co-sponsor a conference on faith inclusion, thinking that while the UCEDD can do good outreach to the disability community, the Hartford Seminary can do phenomenal outreach to faith communities. So we held meetings last spring and summer. We had a conference scheduled for October. It really was a collaborative process. Not just in the logistics, but also in the content, as we really developed a plan for how we wanted to proceed. So the seminary did provide space, they provided food, and they did a phenomenal job in outreach to faith communities. And the UCEDD managed registration. We paid for the keynote, wonderful keynote from Bill Gaventa. We paid for sign language interpreters, and we paid Candace as a consultant to help us plan this conference. So it really was a joint effort. So here's what we had. It was a conference called Inclusive Voices, Welcoming People with Disabilities. It was a 4-hour conference that was in dialogue with the seminary. They felt that was the preferred amount of time. We did it from 4 until 8 in the evening, which was a time when they felt that many of their faith leaders could come to a conference. We opened with a welcome from the Hartford Seminary president and myself and Candace. We had an opening prayer by Candace and then a keynote from Bill Gaventa. And then we put together a panel discussion, and we spent quite a time planning this panel because we really wanted it to be representative. So we had a deacon from the Church of St. Timothy's. We had a pastoral psychotherapist Quaker who also attends Emmanuel Congregational Church. We brought in a self-advocate who has autism and had received her master's in religious studies from the Hartford Seminary. We had the coordinator of the Islamic chaplaincy program. We had a senior pastor from a congregational church. And we had a self-advocate and author who provided insight on Jewish traditions and from her perspective as a person with a disability. So they each did some presentations. We had a group discussion, we did a debrief, and then we did a closing prayer. And I'll talk a little bit more about content on the panel. So we asked them a number of questions. We asked them to talk about their faith journey. And I have to tell you that when we debriefed at the end of the meeting, the discussion around the faith journey was one that really impressed a lot of our participants. A couple of them asked if we would be willing to capture some of that in written format, that they really felt that was extremely helpful. So the faith journey was either as a clergy trying to embrace diversity or as a person with a disability seeking justice within the faith community. And we asked them to include their personal spiritual journeys, and then how lack of access or practice of disabling theologies impacted their journey. So we really asked them to put perspective on that. Then we asked them to highlight the accessibility of their faith congregation, their church, their building, and explore and share strategies for better inclusion. So what have you done to create more inclusiveness for the disability community? It was a really nice panel. They really covered an array of topics from an array of perspectives. Then we decided to let the groups, we served them dinner, and then we had them sit with groups at their table and ask them to do some breakout discussions. And what we asked them to talk about was how the various faith communities could work together to build a more inclusive community as a whole, and how they could do that within their specific faith community. So we asked them to look at it from both perspectives. So for example, we talked about partnering to hold accessible special events like remembrance events or services of healing. And we also asked them to talk about putting disability issues on their own justice agendas and then partnering to advocate for specific issues. So we really kind of asked them to dig in on both sides. And we gave them about 45 minutes to have that dialogue. So then we gave them a few more questions. What does your faith community need from us as a UCEDD to really build those communities of belonging? So do you need training? Do you need resources? Do you need other meeting opportunities? What do you think the next step should be? And then how can you partner with us and with other faith communities? And here's kind of what they came back with. They liked the interfaith cross-faith representation, the diverse panel, and the keynote. They really liked this networking opportunity that came through loud and clear. And they really loved hearing about the faith journeys. What they asked for from us were more opportunities to continue the dialogue, and they really wanted help starting a faith inclusion network. So I went back to Candace. We have brought her back on as a consultant to facilitate the Faith Inclusion Network, and she's now working with the individuals who attended as well as others who have expressed interest but could not attend that conference to really nurture that. And she's having an event late April with that group to start the dialogue about their own Faith Inclusion Network and to get that going. So we will be supporting that and really working to continue to foster that dialogue. In April 7th to be precise, we're hosting a large conference for about 350 people, not specifically on faith inclusion. However, we do have Dr. Eric Carter coming to speak, and he's going to host a breakout session on faith inclusion. So we've reached out again to the people who attended the conference to see if they wanted to come and connect at that workshop. So in the spring, we will facilitate the formation of one faith inclusion network, and Candace Lowe is doing that. We're going to continue to provide access to resources and information to this group and to others, and we're going to continue to partner with the seminary. In fact, next week, March 2nd, Candace is hosting another event at the seminary, and it will be really looking at justice issues. So it's sort of justice and disability juxtaposed with what the faith communities are doing around justice. We've been doing a lot of other connections. There's a group called Moral Mondays that has a lot of faith community representation, and we have really been infusing disability conversation into that. And in fact, the folks from Moral Mondays have come to a Cross Disability Alliance that we sponsor to really talk more about that. Most exciting for us, I think, is that we're going to explore enrolling a seminary student as a 2020-2021 Lend trainee. We'd really love to have that participation from someone at the Hartford Seminary, and I think we've kind of hit on a nice relationship with them that we want to continue to build. So we're very excited about it. And there is my contact information, should you need to reach out, if there's anything that we can do to answer questions or support you. And with that, I'm going to go on mute and turn this over to Rhonda.
Hello. Thank you very much. I'm really excited to be here today. My name is Rhonda Eppelsheimer. I'm the director at the Oregon Health and Science University, UCEDD. And I have a slide up here about where is Oregon. We are really—
Rhonda, you're not sharing.
Oh,
There's nothing coming up.
How's that? My name is Rhonda Eppelsheimer, and I am the director of the Oregon Health and Science University, UCEDD, and we are really about the same parallel, but exactly opposite side of the country from Molly's UCEDD, and we are out here in Oregon on the beautiful West Coast. To share a little bit about us, we're about a 4.3 million population. Oregon has 36 counties, and we are the 9th largest state in the country. Most of our population is on the west side of the state, the most western side, and actually from about midway to the northwest corner of the state. We are not a particularly diverse state in comparison to the Connecticut UCEDD. We are primarily white, and then we have lower numbers around diverse communities, although I would say in the major population centers, that's probably where most of our diversity is centered. Just a little bit about Oregon faith communities. We are, again, a state of a population of 4 million, and I found it really interesting when you add up all the religious traditions and then look at the unclaimed number here in the state. It's about half and half for people that affiliate with a faith community or tradition. And I think that that's an interesting, because there is opportunity to collaborate and partner, but there's also a large amount of the population that really are not engaging in these types of community practices. So I wanted to share a little bit about how we have developed partnership to move forward with advancing belonging in communities of faith for people with disabilities. We're both sharing that partnership is really key, and our primary partnership has been with the Interfaith Disability Network of Oregon. It's an interfaith community nonprofit that works to share resources from and with faith communities to fully welcome, celebrate, and include the contributions of every person with a disability. And who belongs to, we call them IDNO fondly. This interfaith group is made up of activists, advocates, faith leaders, and interested organizations who believe that more can be done so that people with disabilities can experience a true sense of belonging, participation, and contributing more fully in life in their community. The purpose of IDNO is to help people with disabilities find a more enthusiastic welcome in whichever religious community they wish to associate, to educate religious communities on recognizing the gifts of people with disabilities, and to help provide and create a more enthusiastic welcome for people with disabilities. And this interfaith group has developed trainings, they share resources, develop community events to raise awareness, to increase inclusion and belonging for people with disabilities. This slide shares some of the things that the UCEDD has done in collaboration and partnership with IDNO. I really have a strong sense that UCEDDs are uniquely situated to bring our resources, data, and infrastructure, including dissemination and technology, to these community partnerships. Our UCEDD first got involved with IDNO in 2013-14 as a collaborator in developing a one-day conference. In 2014, Beyond the Ramp conference was held in Portland, Oregon, and our moderator, Bill Gaventa, came as the keynote speaker. There were workshops throughout the day and about 85 people in attendance. It was a mix of clergy, religious leaders, interfaith community members, parents, self-advocates, and service agencies. We had a really broad range of attendees that were interested in this topic. The UCEDD's role, we were really a financial sponsor for the event and helped develop a panel discussion for the plenary session. This discussion was comprised of young adults with disabilities sharing their stories of belonging and the challenges that came along with that in their communities of faith, and the impact that having access to a faith community had in their lives. The second strategy that we've used is really trying to better understand barriers and gaps. And so after that early conference event in 2014, I began to wonder about what was next. Our UCEDD developed a community engagement grant program, awarding up to $1,000 annually to different nonprofits in the community that develop projects with an emphasis on spirituality and disability. As I was wondering about how we were going to keep the momentum going, I learned at our national network meeting in the Spirituality SIG that Dr. Eric Carter had conducted an engagement, a survey on engagement in faith and spiritual communities. With his permission, I began to work with a group of self-advocates here in Oregon and IDNO to develop the survey so we could learn more about people with what people with disabilities felt they needed and wanted so they could belong and feel like they belong to their communities of faith, and what compared to what leaders, paid and non-paid staff and community members felt was needed to promote inclusion and belonging. And so this information was developed from an existing survey. It included people with disabilities and discussions about known issues, and it was reviewed, the survey was reviewed by people from a variety of faith traditions and practices as well before we launched it. And I'll come back to this second strategy and how we actually implemented it in the context of an interfaith community event, leading to our next strategy, community engagement. And I think this is another key way to kind of promote these ideas of inclusion is actually being involved and committed, showing up. and developing relationships. So once we had this initial conference event, we wanted to continue to support that momentum. There are lots of options. We could have continued to work on annual conference development. We shared how it was done with others and provided TA to other groups that were interested in doing this. We developed programs and trainings, and these are all great activities. IDNO has continued to gather the community in a variety of trainings and community events as well. And we've continued to be a strong collaborator in those activities. In the latest effort, we just recently had a mini conference gathering over 20 interfaith leaders, and that included folks from Islamic social services, Jewish Board of Rabbis and synagogue executive directors, the Protestant, the Presbytery, Lutheran, Church of Latter-day Saints, Episcopal, Church of Christ, Catholic Archdiocese, as well as agencies, services, and non-denominational groups such as Bethesda, the L'Arche community, parent self-advocacy groups here in Oregon, FACT Oregon, Quiet Waters Outreach, New Wineskin community. So this event was intended as an opportunity to gather religious leaders who are interested in removing barriers and increasing inclusion and belonging in their communities. And the design of the event really was to share data, have discussion, and brainstorm next steps and do some initial planning for future activities. The meeting agenda is packed. We were really focused. It was interactive. We had a brief survey at the beginning to set the tone and understand the baseline for the people in attendance. Questions included things such as accessibility to facilities, and can people easily access buildings, grounds, and restrooms? Are people with disabilities represented on existing boards and communities? Mental health thinking, are people with mental illness welcome and involved? And safety and security, do visitors and members with disabilities feel safe in the building, on the grounds, or where they might be waiting for public transportation? And then we actually asked them to share one idea where they feel their community or tradition does really well in terms of disability inclusion and what they'd like to learn more about. So the data part of the agenda, I'm gonna just skip over that briefly because I'll get back to that. The facilitated discussion really was asking these groups in small groups with scribes, what is going well? What are the challenges beyond physical access to including people with disabilities? What contributes to the struggle of full inclusion, and what actually perpetuates the barriers? What are the educational needs in terms of attitudes and welcome? And then the group share out session was done as a large group, and we really asked people to share 3 important themes that came up at their table discussions. And then we also asked them to share resources that they knew about and learned about in the context of those discussions. The brainstorming really was specific in asking, what are your thoughts on supporting people with disabilities to fully belong in communities of faith? What types of training, resources, and support would be helpful to faith communities and congregations? What specifically could IDNO focus on to support inclusion efforts? And I'll add a caveat to that. As a strong collaborator and partner, we're really looking at that through the lens of what could the UCEDD also do. IDNO now has a lot of data to sort through from that mini conference, and the UCEDD is in the process of compiling and organizing it so we can assist with kind of coming up with our action plan. So I want to get back to that data piece and the UCEDD's role. These are all things that we have done: attending planning meetings, assisting with agenda development, really kind of bringing the resources that we have from across our broader AUCD network, and then helping develop an evaluation plan and data collection plan. And then this last one, sharing data related to inclusion in spiritual faith communities. I've underlined that because that is really the work that we did to help frame the conversation that was going to happen at this meeting. So I'll get back to this. So our part was really to share information from the survey that we had done. As part of our 5-year strategic planning, the UCEDD assessed the need in Oregon to help improve the health and quality of life for Oregonians with disabilities. One of our initiatives focused on improving access and inclusion to spiritual supports in faith communities across Oregon. So with permission, again, we adapted the existing survey, the strengths, experiences, spirituality, and well-being of young people with intellectual disabilities or autism survey that came out of Vanderbilt Kennedy Center and Dr. Eric Carter's work. Our purpose with this survey was really to learn about how people with disabilities are actually participating in their spiritual and faith communities, better understanding the perceptions of what faith leaders and members feel is needed, and identify barriers to participation. The results are providing a place for dialogue to begin within communities of faith to become more welcoming and inclusive of people with disabilities. It was a voluntary web-based survey. Recruitment happened through social media, direct phone calling, and I'll say yay for UCEDDs who have summer interns. They did a lot of work trying to get folks to take the survey. Presentations, networking were also used to recruit respondents. And then we had 59 completed surveys, 18 represented adults with disabilities, 20 represented parents, caregivers, or family members, and that was both of adults and children, so it was split almost evenly. And then 21 of the responses represented clergy or spiritual community leaders, paid staff, lay leaders, spiritual community or congregation members. 53 of the survey participants identified as Oregonians or supporting someone in Oregon, and we had 6 out-of-state responses, 2 in Texas, Florida, Maryland, Arizona, and North Carolina. So that was kind of exciting too. So the next 2 slides are going to highlight, I'm going to highlight some of the data shared at the meeting that helped frame the discussion time. This is not by any means all of the data that was collected in the survey, and nor was it all that was presented at the mini conference. I'm only going to share results of 2 of the 8 comparisons questions that we shared. And mainly there was just too much data in the survey, so we had to have careful consideration of what was going to really help forward the goals of the mini conference. So this first set of questions helped us gain understanding for what respondents, for the respondents of this survey about how people with disabilities actually participate in faith communities and spiritual practices. There were 14 items in this question, 14 different participation activities. I'm only going to share 6 of them here just for purposes of today's presentation, and that's all that we shared at the mini conference, just so you can kind of get a flavor of what happened. The question for people with disabilities, their families, and carers was, over the last year, I participated in a congregation or spiritual community in the following ways. And you'll see on the left-hand side the types of activities: attended worship services, fellowship, sacraments, rites of passage, led sacred readings, or participated in religious education. And what I'll say about that is that not all traditions do these things. And so we also had a way for people to opt out of that question and indicate that it's not applicable to their faith tradition. And then for the religious leaders, faith community members, the question was, over the last year, individuals, children, or families who experienced disability participated in the congregation or spiritual community in the following ways. And they had the same response options. We considered frequent as once a week or once a month participation, and infrequent as one time a year or never. We also had I already talked to you about the not applicable piece. So what we learned about participation was really interesting and compelling. We saw statistical significance in the range of agreement between actual experiences of people with disabilities, family and carers, and compared to religious leaders and faith community members. And then some activities had really significantly low frequency. So for example, we look at attending worship services. The agreement between people with disabilities and religious leaders was less than 10% difference. And it was actually a really strong category or response section. It was happening actually happening from both perspectives, well more than 50%. For fellowship, there was less than 10% difference in their agreement, and again, was happening well more than 50%. Sacraments, and I think this is an interesting one, there was a greater than 10% difference. And then from the people with disabilities, families, and carers perspective, it was happening less than 50%. And for religious and faith community leaders, their perception was that it was happening significantly more. Rites of passage, again, less than 10% difference, but if you'll go clear over to the far right column, no people with disabilities reported that this was happening, and only 4% of religious and faith leaders reported that it was happening. Leading sacred readings, participating in the service as a leader, there was a greater than 10% difference in the responses. And if you look at the far right column, 0 people with disabilities, families, and carers reported that they were participating in that way. And only 15% of religious and faith leaders said that was happening. Religious education, that could be Sunday school, youth group, adult education, again, a greater than 10% difference. And then if you look at how this kind of played out, people with disabilities reported that it was happening less than 50%, and religious and faith leaders reported that it was happening more. So our question to the conference was, how might this information be used for community discussion and developing education and training? Where is their capacity to grow? Is it in the dialogue? Is it something that people want to do more of? I think that's a great thing that people can then get together and talk about. My sense from the people that were participating in the conference, it was really validating. These were observed, and it was really acknowledged as good place to start the discussion. The second data slide that I'm going to share with you today asks about actual supports. And I'm only going to show 6 of the 15 items that we surveyed on. The first column is actually the support. The second is how important is this support for participation to people with disabilities and their families. And then the agreement and disagreement is if it's whether or not the support is being provided. And then again, we looked at the frequency. Is it happening less than 50% or more? And I'll just say, I really wrestled with, it's a lot of data to digest, and how do we present this back to the community in a way that's actually meaningful and understandable? And so I'll kind of run through a couple of these real quick just to give you a flavor of it. of things that kind of showed as a strength and things that may present opportunities. So respite care for families, folks said that was, there was 75% of folks that responded that said this is really pretty, 75% is pretty important to us. There was a greater than 10% difference in agreement about this. So 0% of the respondents, people with disabilities, said this was being provided, and 19% of religious and faith leaders and community members said this was being provided in their faith settings. And then you think about 0 and 19, that's just, it's barely on the radar there when we're looking at frequency. Special worship services could be quiet, low stimulation settings, or having a space for service animals, those types of things. That was 63% importance, less than 10% difference in agreement. And then if we slide over to that far right column, again, pretty significantly under 50%. A real strength that kind of came out and was spiritual counseling, and this was by a religious or faith community leader. And 67% said that was really important. There was less than 10% difference. And over 70%, well over 70% recognized from both perspectives that this was happening. Modified programs, a variety of learning styles, 67% said it was important. There was a less than 10% difference. And then if we slide over again, even though there was a slight, small difference, there's quite a lot of room for potential growth there. Physical access to buildings, restrooms, to the properties, rated also very high, really important, less than 10% difference. I think well over 80% said this was actually happening, so a strength. And then again, disability awareness for congregations. This was by far the most important people who responded to this survey. There was a greater than 10% difference in the response of and perspective of people with disabilities who say this is happening, and religious and faith leaders and community members. So I think, and again, under 50%, so another opportunity for growth. This data provided some real life experience and overwhelmingly supported that things are going well. There is also specific areas where focused growth could happen. It provided a frame for the conversation and informed the next steps. So feedback from the participants really included, there were just lots of ideas that were generated and brainstormed. And it was interesting to listen to Molly talk because they're not unsimilar in what we came up with. And really the last two, people were very compelled to kind of make some action steps around those. So holding more gatherings, strategizing about future actions, having more networking opportunities. People really enjoyed gathering and just talking about this and trying to figure out what to do and how they could work together across a broad range of traditions. Build a community action plan, and then develop some resources that really provide training to faith communities and leaders. And I think the most lifted up thing was talking about and sharing stories of inclusion and how that's working well in people's lives. The next steps for this UCEDD, and really what I learned from this experience, is that it's important to disseminate information in a variety of ways. First, analyzing and sharing information in our UCEDD network is really good, and through presentations and publications. But also, I think what I really learned from this experience was that data can be really meaningful in the community context. It was developed with people who have that lived experience. And I really wrestled about how to present data in a way that might be informative and really useful and encourage dialogue that will actually lead to lessening the gaps and providing opportunity for people to feel like they actually belong in these communities of faith, and feel included. And then I'd say IDNO we're gonna continue to work with them to develop future trainings and conferences. And then this third step, we have in our 5-year plan to really develop a training program for disability serving organizations. And I'm thinking a cohort that develops an actual capstone project in their faith community, focusing on increasing awareness and becoming more inclusive of people with disabilities and their families. So stay tuned for that. Here is my contact information, and we are just happy to share more about the work we're doing. So please feel free to reach out anytime. And then I'll move on. I'll turn it over to Bill. Here is the question and answer period. And be sure at the end of the session, it'll really help us out if you will fill out our evaluation for today. Thank you.
And let's leave that slide up so people can get, we'll see that, can see that the web address for the evaluation. And we want to thank people who are on. We know from our experience with these webinars that, excuse me, sometimes the groups are small, but many more people than the number who attend a webinar, you come back to the webinar or come to it later from our archived webinars. So Rhonda, there was okay, you've already answered the first question about the evaluation, and also there was a question about being able to get a copy of the survey that you sent out. I'm assuming that's possible for people to get that from you?
Yes, I would be really happy to share the survey, and I'd love to actually have a conversation rather than just send it out. So if people just email me here at OHSU, I'm really happy to do that. There's some complexity around how the questions line up, so I just love to go through that with folks.
Okay, so share the text and also help the interpretation. That sounds fairly religious. One of the things I'm struck about for people is that talking about the research and the training components of both of the presentations. Some people may not know that the 4 foundations of University Centers of Excellence are training, technical assistance, research, and dissemination. And so it strikes me from both of your presentations that those are some of the skills and capacities that UCEDDs can bring to the table in terms of working on a multi-faith basis and with community partners, and as well as disability groups around this area, around congregational supports and inclusive ministries. So one of my questions that I'm kind of intrigued with is, did any of the people that you worked with or first reached out to in terms of working with you, and this is for Molly or Rhonda, how much awareness did you have to build about what a UCEDD was? And was there any reluctance because of who you are?
This is Molly. So there was not so much with a lot of our partners who came to our events, but in our initial context with the Hartford Seminary, it took a little bit of dialogue to kind of get them to understand exactly what we do. But once they really grasped it, they were ready. And part of that is just that for the Hartford Seminary, they really were ready to embrace this dialogue and to do what they could do to promote inclusive communities. So they just embraced it. And we've continued to have a very nice, healthy dialogue with them, to partner on events. And as I said, I'm really hopeful that we will have a Lend Fellow coming from Hartford Seminary for the fall semester. So did they understand us at first? Absolutely not. But they had the passion. And I think that to me is what we grasped. We got it, that the seminary wanted to do this. And once we presented them with some resources that we could provide to work with them, they were more than happy to be our partner.
And I'll just chime in. I think it took a little bit of time. I'd agree with Molly on just kind of educating on what we do. But I think my sense was there was just some overwhelming surprise and warm welcome because a federally funded program at a university medical center actually had this notion to be engaged with community partners. And we learn, as what I want to really state is that, you know, this kind of we learned from our community just as much, I think, as we can bring and offer to our community. So I've really tried to share that message, and that we also consider faith and spiritual health as part of a holistic, healthy approach to living. And that's where where we found so much common ground. So it's been a warm and wonderful collaboration over several years now. But I think we're always still discovering what more we can bring to that partnership.
So then let me ask you about another challenge, or how you handled that. Were there any challenges for you all about doing a multi-faith event?
For us, it wasn't so much a challenge of doing a multi-faith event. It was that the seminary presented us with the mechanisms to really make that happen. And maybe it's just a function of the Hartford Seminary community, but because they are a non-denominational seminary and have such a rich history of reaching out to many diverse faiths, it was not a challenge at all. And the people who were in the room really appreciated each other. It was really quite amazing, the kind of sharing that they're doing and continue to do. And I expect that will continue with our next endeavor. So I didn't find it a challenge per se at all. It was just very, very exciting for us to have that.
And this is Rhonda. I will say that not a challenge in the sense that we were going to reach out to across faith traditions. But what I will say is that within the IDNO group and our collaborating groups, we had to have some really hard discussions about intention versus our actual actions, and even the language we use around how we welcome and invite people into the events and things we're doing. And one of the times when I really had that kind of amplified was, you know, I was reaching out to lots of different people to review the survey and give me some really good critical feedback on it. And one seminarian actually read through it and gave me a lot of really good feedback about how this is really Judeo-Christian based, and that you aren't even using language around mosques, temples, those types of things. So we made some great edits based on that. I still think we have more to do, more work to do on that. But I think it's a great question, Bill, and I think we have to be continually challenging ourselves to get outside of where we might feel most comfortable.
Yeah, my hunch is that because you opened yourself up for that kind of feedback, that people were able to do that because they knew that you partly felt more comfortable doing that because they knew that you were not in a particular religious camp.
Yes.
So one of my hunches for a long time has been that the UCEDDs are in a sense neutral territory. So that, and that also my experience has been, like you said, Molly, that people in faith communities are, once they understand who you are often very gratified that people in more secular helping or human or medical services are reaching out to affirm the importance of what they do and wish to work along with you.
I think that's really true, and it actually was. There was a bit of surprise at the seminary as well. I would echo what Rhonda said, that there was a bit of surprise that that the university would be interested in doing this. But once they understood that when we talk about including people with disabilities, it embraces all aspects of community, and that includes faith communities. Once they got that, it was an easy ask to pull something together with them.
So I don't want to give a wrong impression about something, but both of you helped contribute finances for these conferences and events. I'm assuming, and you did that out of some of the funds that you receive. I'm assuming, though, that you were able to do this on a fairly limited budget, knowing what I know about UCEDD budgets.
Indeed, it was a fairly limited budget, I would say, because we didn't have to do anything with space or food, and we did a lot of the other work just in-house. It was probably under $6,000 that we spent on our efforts, and that
I would note would be a significant contribution to faith communities who would have, or people maybe advocates around inclusive ministries who would have a hard time finding that money. So
yes, that's why they were so excited that we would be willing to do this with them, because they didn't have the resources to do it on their own, but they clearly wanted to make something like this happen. And by the way, continue to want to make this happen. So as we're reaching out now to move forward with the Faith Inclusion Network, that's been met with a lot of enthusiasm and excitement. So it continues.
And then I'll just add to that, Bill, in the 2014 conference, we were in for about $4,000 of core funds that we had planned around space and all the keynote speaker, travel, all of those expenses. And then I would say as we've moved on, the types of activities we're doing, we've been able to leverage those into research projects and activities within the 5-year plan. So it's in-house work that we're doing. We have already a pretty active, well-developed outreach and dissemination kind of as I would assume all UCEDDs do for advertising, recruiting, those types of things. So we are able to run those pretty easily through our in-house mechanisms that are already established. So those are ways that we can continue to provide ongoing support. And yeah, so.
But one of the exciting things to me when you both talk about then trying to figure out ways to involve seminarians or faith community interns in the training, in the more extensive training programs at your respective sites, is that there's also, you have numbers of people coming from other disciplines in internship programs through your sites, and just the prospect of then they're knowing that you've got this kind of activity going on, thinking about people who might get interested in doing research projects of their own in this area of spiritual supports and religious supports, and the kind of thing that Eric Carter and his colleagues are so good about. But there's such a ripe area here for people to explore and to get some of the data which we in the faith community often don't have.
That's true. There was a question in the chat box about whether we hosted our events in the community or at the UCEDD. For us, we do most of our events in the community, and that certainly applies very much so to the faith initiative. So Hartford Seminary is right in Hartford, and it is a good site for a number of our events. The Faith Inclusion Network is actually being hosted by one of our synagogues that happens to be on a bus line and is fully accessible, and the rabbi there has an older son with autism and has really opened up his congregation for a number of our initiatives. In fact, that's where the DD Council holds all their meetings. So it's a common place for us to use, and I expect we'll be using it a fair amount.
Well, we need to close up. One of the characteristics of most UCEDDs is that they're in university or medical centers, and they have terrible parking. And often not big spaces. There's one that just came in from another question about conference time frame. You can see that one of the ones that was done by Connecticut was just half a day. Another one was done a day, I think, and what they did was work out a format and time with community partners that they thought they could get the most, that was most convenient to clergy and people that they knew. We need to move on to honor our time. So this webinar, I want to thank Molly and Rhonda both for terrific presentations, and I think ones that will be useful for people in the future as well. There are UCEDDs in every state, and if you don't know the one that's in your state, go to www.aucd.org, and you'll see a map in the left-hand corner of the United States, and click under University Centers of Excellence and your state, and you'll get to information about how to contact people who are there. Next month, the webinar is about, is in partnership with several colleges and also with the National Think College information and resource site, and it's about faith-based universities becoming homes for post-secondary programs and some of the dynamics of that and those very exciting opportunities and developments in higher education for people with intellectual and developmental disabilities. We're still working out the last two webinars of the series, but again, thank you very much to Rhonda and Molly for a great job, and thank you everyone for joining us. Have a good day.
Thanks, everybody.